Can you tell me something about shell shock?
Yeah, I mean, I think shell shock is a well-known term from the First World War. It's essentially a psychological reaction to an intolerable combat situation, which trench warfare in the First World War certainly was. It wasn't unique to the First World War. Similar syndromes were known in the Second World War. It was known as battle fatigue then. And later the Vietnam War and Korean War, and it was around that time and afterwards that actually the disease, which almost certainly is what shell shock and battle fatigue represent, became known as post-traumatic stress disorder, PTSD, and that's now a totally accepted psychological psychiatric diagnosis. The features of shell shock were a reaction to trench warfare, which of course was horrific, and it was horrific in many ways. It was noisy. Sleep was almost impossible for days and weeks on end. There was a high likelihood of death. Comrades were dying all the time. It was cold. It was wet. It was difficult to lie down and rest. There was lack of information as to what was going on. It was a very stressful situation, and not surprisingly, this had psychological repercussions. And men with shell shock would enter a variety of states. They would become withdrawn, they would become depressed, morose. They would sometimes run away from the battle scene, and a number of them were shot at dawn for deserting. One of the characteristics also was that many of these men had what were at the time called hysterical symptoms. We wouldn't use that term now. We'd use terms such as somatization reactions, conversion symptoms, but basically this is the mind reacting to the stress by giving organic bodily symptoms, and this could include respiratory disorders, hyperventilation, diarrhea, various pains, paralysis, inability to talk, abnormal gaits, postures and so on. And these were quite characteristic of the early severe forms of shell shock. Sadly, largely not put down to psychological reactions until perhaps later on in the war, when a number of these men were actually repatriated. And perhaps the classic example of that is, which you may have heard of, is Craig Lockhart Hospital, and there were a number of other military psychiatric establishments where some men were brought back to. And Craig Lockhart outside Edinburgh treated the two famous war poets, Siegfried Sassoon and Wilfred Owen. And they were very fortunate to be treated by a psychiatrist called Dr. William Rivers, who was very much ahead of his time in that he used a supportive and analytical approach to these men, whereas others, many of his colleagues, would use aversion therapy, which could include electric shock treatment and so on. But Rivers was a kind patient and an analytic psychiatrist, and certainly Sassoon and Owen did very well under his care. Sadly, Owen did so well that he went back to the trenches and died shortly before the end of the war.
Right. Has the School of Tropical Medicine been involved in any way in cases of shell shock, or what during the Second World War? I'm thinking of what lessons learned from the First World War. Was this a problem at all during the Second War?
Yes, it was. The Tropical School had no input to repatriation of psychiatrically ill men in the First World War. In the Second World War, again, no specific role, but afterwards, as you know, we started seeing many ex-Far East prisoners of war. And well over 2,000 of those men were seen in the decades after the Second World War, and it became very well recognised that they did have a very classic form of post-traumatic stress disorder. Probably about 40% in all, and by the 1970s those men were specifically seen by a local psychiatrist, Dr. Kamal Khan, and given specific supportive treatment, perhaps a little late in the day, but nevertheless with great benefit. If you move that up to modern times, then the wheel really has turned around, and the British Army are very understanding of the potential risk of PTSD. There are buddy systems, support systems actually in the field, and there are debriefing and counselling systems for when men come back home. So I think lessons from the First World War were learnt in the Second World War. Lessons from the Second World War have been learnt in modern warfare too.
Thank you.